Hi everybody. Just before jumping into the video today, if you don't mind taking a quick second to please like or share or subscribe or post a quick comment on the video, I'd really appreciate it. So thanks in advance for taking a second to do that. So today's video is a reply to a question, as per usual. Lots of questions. Thanks for submitting all the questions. Makes it so easy for me to create content for my channel because I can just answer your questions. So it's wonderful. Very synergistic. So the question is, what autoimmune disease can trigger seizures when having fevers? A pediatric family member is allergic to vitamin D and keeps getting viruses very easily. Lately, it seems to be patterned the same time each month for the past few months. And then it says, can blank cause seizures? I think maybe autocorrect kind of got in the way, but I think the question is referring to the syndrome that's referred to as periodic fevers, aphthous stomatitis, oh my goodness, what's the next one? Pharyngitis and adenitis. And so asking if that syndrome can cause seizures. Any info to point our doctor in a more productive direction would be so helpful. Thank you. Thank you for the question. As per usual, I cannot provide any medical advice over social media. This is for informational purposes only, and already working with a doctor, so continue to work with that clinician to get medical advice. But I can, just kind of chime in on more of an academic level on this to some extent. So in my experience, I've had quite a few patients where they have seizures or they have kind of like seizure-like activity, but not actually seizures. They'll go get an EEG, a brain scan to see if they have seizures, and they're not actually having a seizure, even though to the naked eye, it looks like it would be a seizure. And so having periodic seizures is something, and especially where it seems to be timing like every month, it really begs the question, is there, in terms of the differential diagnosis list that I would be thinking of, presuming that a neurologist has already been brought in on this and they haven't figured out a more plausible explanation, things that I would be thinking of if I had a patient like this in my practice would be anything that causes neuroinflammation. And for anyone who listens to my podcast episodes, if you haven't already checked out the episode that I posted just within the last week with Dr. Gary Kaplan, a really brilliant doctor from the States, all about neuroinflammation, really, really important topic, even for folks who are not dealing with seizure disorders or seizure-like symptoms. Really important for anyone dealing with complex chronic illness, in my opinion, to be aware of this topic, or at least their clinicians should be aware of it. But anything that causes neuroinflammation would be something to have on the differential diagnosis list to be ruling in or ruling out. So that would include mold toxicity, that would include chronic infections like neuroborreliosis, Bartonellosis, mycoplasmosis. It would also be something to particularly consider maybe other species of Borrelia, which will sometimes cause these relapsing fever pictures. So definitely looking at microbes. Also thinking about other things that may have triggered neuroinflammation, like around toxins, heavy metals, that type of thing. So if I had a patient like this in my practice, I'd be asking about the timeline, what kind of exposures they'd had over the course of time. Fortunately, many pediatric patients in this day and age are not exposed to excessive amounts of chemicals and whatnot, but it is something that does happen sometimes if someone's living in say a rural community and there's lots of pesticides being sprayed, for example. Some people's genetics just can't handle those pesticides nearly as well, and that could be a trigger. So it's not always an infection, it's not always mold mycotoxins, but those would be things that I would be personally looking into. And then of course there are things like immunomodulators and anti-inflammatories that could potentially help with the symptomatic component of things, but those are the types of things that I would be looking at. In terms of whether the periodic fever, aphthous stomatitis, pharyngitis and adenitis syndrome could potentially cause seizures. I'm not aware of that causing seizures. However, with that syndrome, it is something that could be related potentially to strep, maybe staphylococcus, and those are triggering organisms, of course, strep for pandas, but staphylococcus or maybe other microbes that are kind of natural inhabitants of the sinuses, the back of the throat, could potentially be triggers for PANS. And of course, where PANS is characterized by notable neuroinflammation, that would definitely be something to think about. So in analogous cases, it may be worthwhile to consider running something like a Cunningham panel, or like to look for markers of neuroinflammation to see if that, or of I should say markers of autoimmune, markers indicating that there is an autoimmune condition affecting the brain, and also thinking about possibly doing some throat swab for to rule in or rule out whether there's a strep overgrowth, maybe doing some blood work to see if there's elevated anti-strep antibodies, but bearing in mind that those tests can sometimes come back negative even when the problem is indeed something that was triggered by strep or staph or something like that. So the lab testing is wonderful, but it doesn't preclude the kind of clinical course, and sometimes we need to do clinical therapeutic trials to see if maybe a throat spray or antibiotics or something like that might have a positive outcome. Also, just isn't really a question in here, but just of note the fact that this family member is quote unquote allergic to vitamin D, and I realize that could mean one of many things. Like, is it actually a true allergy? Probably not, because we make vitamin D and without it we can't survive. But is it that there's negative reactions that happen when this person takes vitamin D as a supplement? Is there a rash that forms or occurs, or does it seem to trigger the seizures or what have you? So the just when folks react negatively to vitamin D, it does beg the question: is there maybe a vitamin D resistance pattern going on? What's happening with vitamin D receptor genes? And is that maybe giving some type of a clue in terms of the underlying pathophysiology as well? So that'd be something that I would be maybe exploring as well. So thank you for the question. I really hope that some answers are found for this pediatric patient, because it's awful when anybody's afflicted with health issues, serious health issues. I mean, any health issues are no picnic, but it's awful when anybody's afflicted with serious health issues, especially when it's kids. At least in my opinion, they tug on my heartstrings, probably because I have 3 of them running around at home. But anyways, thank you for the question. I hope that your family member is doing better soon. If anybody has any questions or comments around this topic, don't hesitate to post in the comment section below. Otherwise, I will leave it there for now.